Our attention over to the coronavirus. India has recorded the highest single-day surge of 97,570 coronavirus cases with 1,201 fatalities. With this, the total tally of infections has risen to over 4.6 million. The total number of fatalities have also crossed the 77,000 mark. On your screens, as you can see, is the daily surge in the number of the coronavirus infections recorded over the past 10 days. The state of Maharashtra has now become the worst affected region in the world, superseding the hotspots in United States and Brazil. Maharashtra has reported over 1 million cases of COVID-19, followed by Sao Paulo with over 880,000 cases. And California, which has recorded over 750,000 COVID-19 cases. Meanwhile, India's recovery rate has improved to 77.77%, with the death rate at 1.66%. India is now adding more cases in a day than any other country in the world. At the current pace, India's outbreak will eclipse America's in roughly 50 days from now. Unlike the United States and Brazil, India's case growth is still accelerating 8 months after its first coronavirus case was reported in January. The virus has been spreading across India, even gaining speed, fueled by the high population density in several parts. Now, while India is showing no signs of bending the coronavirus curve, the Indian Journal of Medical Research has revealed some shocking statistics of the country's COVID-19 cases. The research paper suggests that millions of coronavirus cases may have gone undetected in India earlier this year. The Indian government scientists and other experts have conducted the nationwide survey for the month of May and early June. And the research suggests that for every one confirmed case, there were 82,230 undetected coronavirus cases. And this ratio stands for just the month of May, when the total confirmed cases stood at 180,000, which means that the country had nearly 6.5 million cases in just the month of May. During the survey period, India was conducting around 100,000 tests per day. It has ramped the testing up to more than 1.1 million tests a day. Infections are growing faster in India than anywhere else in the world, and the Health Ministry has reported another record daily jump of over 96,000 new cases on Friday, taking the official total caseload to 4.5 million. However, the fatality rate has so far remained relatively low. And speaking of the coronavirus, people in Nepal are growing increasingly angry over the administration's handling of the coronavirus pandemic. Several students have taken to the streets demanding a better response to the pandemic by the government. Prime Minister KP Sharma Oli is at the centre, facing public anger. He is being criticised for his government's lacklustre and unscientific handling of the pandemic. Oli has been accused of neglecting the pandemic situation while being embroiled in a power struggle within his ruling party. Allegations have also been raised against the top government officials of engaging in corruption while purchasing medical equipment and supplies from abroad. In Kathmandu, protesters have been met with resistance from the police. The police has wielded batons and also used water cannons to disrupt the protests. Some detentions have also been made.
सबै नागरिकलाई समान रूपले हेर्ने त राज्यको दायित्व हो नि त त्यो दायित्व पूरा गर्नुपर्ने बेलामा यस्तो झन् यो पेन्डेमिकको बेलामा महामारीको बेलामा राज्यको उपस्थिति झनै एकदम आवश्यक हुन्छ नि त्यो बेलामा राज्यले आफ्नो उपस्थिति देखाउन नसकेकोले चाहिँ त्यो चित्त दुखेरै भनौं न रिस उठेर भन्दा पनि चित्तै दुखेको हो के त्यसरी सुरु भएको भनौं.
Protesters have also taken to social media to criticize the government. #StopDemocide. Prime Minister Oli is trending on social media. Democide means the intentional killing of an unarmed person by government agents. Wide-ranging protests have yielded results in varying degrees. The government has now scrapped the use of rapid diagnostic tests for coronavirus. A complete switch has been made to the PCR tests, a gold standard to detect coronavirus infection. The number of daily tests has also been increased. Authorities have agreed to provide better personal protective equipment for frontline healthcare workers.
हामीले आइडियली हामीले जस्तो खोजेका छौं त्यस्तो चाहिँ भएको छैन तर इट्स स्टिल इम्प्रुभड हुन्छ नि अहिले जस्तो होल्डिङ सेन्टर राख्ने कुरा अनि त्यसपछि अनि सबै विदेशबाट आउने सबैको टेस्टिङ गर्ने भन्ने कुराहरु छन् हैन सो यो राम्रो कुराहरु छ त्यसपछि कन्ट्याक्ट ट्रेसिङ एफर्ट्सहरुमा जोड दिने अनि अहिले अब जुन नयाँ एग्रीमेन्टमा चाहिँ कसैलाई चाहिँ मेडिकल सेफ्टी इक्विपमेन्टहरु पर्सनल प्रोटेक्टिभ इक्विपमेन्टहरू कोही मेडिकल वर्करहरूलाई चाहिन्छन् भने यो स्वास्थ्य मन्त्रालयले एउटा हेल्पलाइन हटलाइन बनाइदिएको छ होइन सो एनी वान क्यान एक्सेस पिपिइजहरू गभर्मेन्टबाटै सिधै होइन सो यस्तो कुराहरू चाहिँ आई थिङ्क त्यो ठुलो उपलब्धिहरू छन्
With a rise in the number of cases recently, restrictions have been reimposed in several areas. Nepal has till now reported over 51,000 cases and more than 300 deaths.